Hello, I'm Dr. Stephen Akins, and I want to welcome you to the 2015 debate on the Patient Protection and Affordable Care Act, organized by students of the School of Public Affairs at the University of South Florida. This debate is about three issues. First, whether it was necessary for the federal government to intervene in the nation's healthcare system and pass the Affordable Care Act. Second, whether the Affordable Care Act has impact on the economy, health insurance, as well as the national budget. And finally, should the Affordable Care Act be repealed? If so, what should be put in its place? The participants in this debate are students of political economy in the MPA program of the School of Public Affairs. All views expressed in this debate are the views of the students and not those of the university as an institution or its officers. For the purpose of this debate, the students are playing the roles of senators, and they've been split into two camps. The pro-intervention group of senators who believe that prior to the enactment of the Affordable Care Act, the nation's healthcare system had serious challenges that needed to be addressed, and the best way to address those challenges was to come out with the Affordable Care Act in order to improve accessibility, increase health insurance coverage, and drive down the cost of healthcare. And then we have the anti-intervention group of senators who believe that with all its challenges, our nation's healthcare system really was doing well, and there was no need for any government intervention.
In the United States Senate, we are debating whether or not to repeal the Affordable Care Act, ACA, and replace it with the Health Choice and Patient Protection Act, HCPPA. Never before in the history of the United States has such an action like this taken place. It is unprecedented. I believe many of my fellow colleagues believe the Affordable Care Act is not perfect, as do I. What law is perfect? However, repealing the Affordable Care Act, according to a report from the Nonpartisan Congressional Budget Office, CBO, would add $109 billion to the federal deficit. The other side of the aisle estimates that their bill will cost the federal government less than 50% of the CBO and Joint Committee on Taxation's projected costs over the next decade. But here's the kicker. There's no specifics backing up their claim. No nonpartisan CBO report, no independent analysis, no nothing. In their bill, there's no coverage provision if you happen to lose your job or become unemployed. In addition, if their bill becomes law, what will happen to the individuals who signed up on the ACA? Will they have to sign up again to the proposed new law? Will they transfer over automatically? That seems to be an unnecessary burden. Our constituents sent us here to Washington to work together. They deserve better. Again, almost all of us agree that the ACA is not perfect. Let us work together to strengthen the ACA and fix what is wrong with it. And with that, Mr. President, I yield back to balance my time.
Thank you, Majority Leader. The Minority Leader, Senator West, is recognized.
Good luck on your second term. The Affordable Care Act has failed. Has failed in providing a Pareto improvement. Some people are paying more and some people are paying less, which means it does not provide Pareto improvement. It hurts businesses and the unemployed. Small businesses are cutting back so they do not meet the 50 employee threshold. Government intervention, yet, is still necessary. We propose instead a repeal and replacing of the ACA with the Bismarck model. The Bismarck model addresses market failures without as much government failure and better addresses the market failures that are in existence. The Bismarck model engages with the markets and does not supersede them and count them out like the ACA does. The ACA fails to produce. The ACA fails to cover shortfalls. There are numerous shortfalls. It does not engage with Medicare and Medicaid fraud. Does not discuss defensive medicine. And does not engage with overall price regulation across the board. Some states it's more expensive, some states it's not. This creates an imbalance. The members of my party will further discuss in more detail the shortcomings and failures of the ACA and strengths of the Bismarck model. We agree that the American people deserve better, and that model is the Bismarck model. Thank you, President.
And I would like clarification on that because the ACA currently aims to do just that. As our majority leader, Senator Beluga, mentioned, we understand that the ACA is not perfect. We understand that there need to be clarifications that need to be made, changes, and yes, it does have shortfalls. However, it does engage with the market and it does engage with the states. Initially, the ACA was aimed to actually work with the states, and all 50 states, they hoped that they would create their own marketplace. Now, if states did not do that and they chose not to, they were allowed to opt out of it, in which case the federal government stepped in and took care of that. Additionally, insurers are the ones who come into the marketplace, and they're the ones who offer insurance and coverage to people. So I would like clarification on the fact that it engages with the market, because the Bismarck model is trying to do exactly what the ACA is trying to do, engage with the market and the states, as well as work with the shortfalls that it has.
The ACA is currently a big government solution trying to interfere with the market, trying to encourage the market to do things that it's not necessarily designed to do, whereas the Bismarck model is the exact opposite of that. The Bismarck model pulls government back to its constitutional framework, or into the constitutional framework, where the government creates a legal framework that designs a clear and unbiased playing field for all players involved. The Bismarck model will allow us, as a government, to pump money into the third wing, the nonprofit part of our economy. This money will allow us to establish nonprofit sickness funds, where the overhead will be a lot lower than your for-profit insurance companies, and you won't have the profit-driving force that is there with the for-profit insurance companies. Once these have been introduced into the market, this new competition will cause for-profit insurers to drop their rates to survive.
German ship that sank? I wasn't sure. But anyway, you had mentioned about introducing a third portion to the ACA, or the healthcare issue of nonprofits, saying that by using them, they're going to be efficient and they're going to help reduce costs. But my question is how is that? Because nonprofits, where is the incentive for them to be efficient? They're not there to make money. They don't make profits. They're there just to operate. So what is their incentive to be efficient in providing any kind of assistance within the healthcare? I yield my time. Thank you.
With nonprofits, we're going to hope through that they follow through on their core values and missions, which will essentially be ensuring that people do have access to affordable health insurance, and with that, they will help, ensure that they're going to be efficient. Now, they won't necessarily be driven by profit, which you might say, how is that going to make sure they're efficient? But there will be other measurable outcomes and performance measurements that will help ensure that are in place.
Set strict regulations on how much a certain procedure should cost, then go ahead and pump money into the third sector in order to have this, organization that's working for the good of the people and not necessarily for profit. That's sounding an awful lot like the public option, where you're having the government, who is supposed to be working for the people for the good of the country, and pumping a lot of money into it. Why not just have that within the Congress's control? I yield the rest of my time.
One thing I would like to question then, again, is if we are going to provide nonprofits with the funds, the subsidies, whatever, in order to insure the poor, or essentially anyone who wants health care, who's in charge of the nonprofits? Who's the one giving nonprofits these controls? Now, are we going to say arbitrarily the American Medical Association is going to be in charge of selecting who gets to watch over these funds? Is it going to be the Department of Health and Human Services? Now, we're back to the same drawing board.
Yep, it's all about the funds that they're speaking of. Moreover, the ACA is leaving many Americans still uncovered. the estimates are in the range of 30 million still uncovered, even after the full implementation of Obamacare. With that being said, you've mentioned Medicaid as a mechanism to expand that coverage. So as states initially receive that funding from the federal government, you have that expansion of Medicaid. What that's leaving is states as with an unfunded mandate. As that federal revenue evaporates, it leaves millions of Americans still uncovered because the federal government stepped in, mandating that each and every American be covered under a health care insurance policy, providing that initial funding to set it up, but then withdrawing that funds when it's deemed unsustainable.
I believe that what the ACA represents is a method for encouraging preventative care. And even with the Bismarck model, you still run into uninsured individuals that will be left to fall through the cracks. So what we want to do is create a healthier America by encouraging people to visit their doctor, to get the colon cancer screenings, to get the mammograms, not to end up in the emergency room because of something that could be treated in the doctor's office.
So we just need a new model. For about 50 years, government programs have failed abysmally. Already with the information system failure. You've already expended and wasted millions of dollars of millions of taxpayer dollars. Another issue in the government handling this is just the lack of information, a lack of qualified staff.
If one of the opposition's goals is to increase subsidies for the lesser off Americans in order for them to get to the healthcare clinics, I think I speak for at least most of my colleagues when I say I completely agree, and that's something that we can add to the Affordable Care Act. Thank you.
Thank you.
I just want to address a couple things about preventative care that we've talked about earlier. One thing that I think we, on our side, will really agree on, so we need largely expanded preventative care in this country, and while the current position of the ACA is that it's maybe not implemented as well as it could be, and we are willing to change that slightly, but we need to understand that modest improves to the health status of U.S. workers could increase the nation's GDP by $905 billion by 2023. I don't see a lot of other ways to expand preventative care other than getting everybody, not just 60%, 70% of people, health insurance, so we need that. A healthier workforce reduces long-term health care costs in this country, so I have a couple questions of how the Bismarck model would give preventative care for everyone.
Can I have a closing argument, please? One more.
Okay.
My friends and colleagues on the other side of the aisle, they would like to talk about amendments. We can acknowledge that amending the ACA to include aspects of the Bismarck model would provide the best outcome. So we would like to amend using parts of the Bismarck model to fill in the gaps left by the ACA. No, I don't want to vote for vote repeal.
Mr. President, they're not carrying any.
The majority leader.
I would call for regular order and a vote, please,
Okay.
whether or not to repeal the Affordable Care
Without objection, so ordered.
Basically, we wanted to switch over to a payroll-based system in which, instead of looking at the number of employees that an employer has, in this case it would be 50. At that point, employers are responsible for paying more for health insurance. With the payroll-based system, instead of looking at it at the 50 number, we'd actually go to an amount that the company makes. So instead of 50, we'll maybe look at for example, 200,000 per business. And from there, we don't have to worry about employers thinking about cutting an employee to get that 50 or to not make that 50. Instead, we look at it on a revenue-based system.
Thank you.
Reality. We in Texas are very reliant on Medicare, and currently the Affordable Care Act is set to cut $716 billion from Medicare over the next 10 years. These cuts are draconian, and we need to be careful. The government needs to be careful before we just start slicing money. One of the greatest Texans, pardon me, sorry. I only have 3 points, and the third one's just slipping my mind, but anyhow, The former director of Medicare and Medicaid, Gail Walensky of the Bush administration, stated that the notion that you could take $700 billion out of Medicare reimbursements and not think you will see some impact over time is ridiculous. And so we just think that before we just start slicing at Medicare, we need to be careful so we don't ruin the program going over 10 years.
Thank you.
Mr. President, thank you very much. My fellow colleagues, again, stunning pearls. Okay, your amendments that you've brought up, caps on hours, increasing it. Now, just before we had this debate, you were saying that your constituents already had issues with the caps because it hurt their businesses. Now you're saying that you want to put caps on how many hours that will be required for that. So aren't they just going to cut people so that they're not working those hours? So, you know, I'm just trying to understand which side of this piece you're on or what you really want. Okay, now the revenue-based cap, I think we could look at it, but in some ways it may have merit. But again, your constituents saying, all right, now you're going to base it on my revenue, so you're still taking money away from me to pay for insurance. So, again, granted, now revenue is after the fact, but, you know, again, I'm concerned about your constituents worrying about the fact that, you know, now you're looking at their revenues as opposed to their workers.
Thank you, President Akins. And just for point of clarity, my esteemed colleague has already brought clarity to some of the issues regarding Medicare and Medicaid. I just would like to point out the first two amendments because there is some confusion on that that's been brought to the floor by Senator Smith and Senator Okai. The minority's position in the second amendment when it comes to the number of hours that an employee can work is basically because we would like to see Americans get at least 40 hours per week. What Senator Okai has proposed is that you would cut them back even further to 20 hours per week, and that's not, I don't think, in the best interest of America.
Okay. The majority leader.
I ask for a recorded vote.
All those in favor of asking employers to insure their employees based on their revenue should raise their hand. All right. Thank you. Hands down, please. And all those opposed, hands up, please. All right. The majority have it.